This is an ABP Live Podcast.
Today is National Doctors' Day, a day of our medical professionals, a day of our heroes, people who are out there saving lives every single second of the day. And we have come to realize the kind of value that these people have all the more in the last 2 years. When each one of us was panicking and was hauled up in our homes, doctors, our heroes, were out there battling the pandemic, helping out each and every case that comes to them and saving people from suffering. And to celebrate this profession, to celebrate medical science, to celebrate our doctors, we have a very special guest today on Cracking Conversations, Dr. Vedant Kabra. Dr. Vedant Kabra is the Principal Director of the Department of Surgical Oncology, Fortis Memorial Research Institute, Gurugram. Dr. Kabra has the experience of over 12,000 cancer surgeries and has successfully performed various complex oncosurgical procedures, including robotic surgery for cancer. I would like to welcome Dr. Vedant Kabra on ABP Live Podcasts. Hello, Dr. Kabra. How are you doing today?
Hello, Niharika. I'm good. Thank you. How are you?
I'm doing very well, and I'm really excited to have this conversation with you.
Thank you, Niharika. I'm also looking forward to it.
So, Doctor, you have worked for so many years in the field of medical science. How has your journey been till date? What were some of the struggles? What were some of the positive things that happened all throughout your journey?
So, like anybody's journey, I have also had my ups and downs over the years. And as you said, I'll focus more on the positive side. Because I think that is very essential in today's time. We see children moving away from taking medicine in our country.
Very true.
Most of the doctors today don't want their children to enter into profession for various hardships that they have to face right from the college days to their public life and their professional life, which is very unfortunate. Because having gone through a lot of hardships myself, I think I must thank God. God has been very kind, very kind to me. And I still feel this is one of the best professions to be in. But let me start with what keeps us going. When you see that your work is bearing fruit, and by that I mean success of your treatment, your patients getting better, your patients being happy when they are going out of hospital, and not merely happy that they got better, but also happy because they were treated well, apart from the medicines, They were spoken to in a nice manner. Things that they needed were taken care of apart from their medical needs, which is not easy to do, but is still possible. Maybe giving an extra minute to them and talking to them with a smiling face, giving them assurance, even in grimmest of situations. I think that is what means a lot. There are patients who understand that they are not going to live for long, and being in cancer, we see such patients very often.
Very true.
But what they want from us is a word of comfort, a reassurance that even if they are not going to live very long, their quality of life is going to be good. So, a success that we see in our work, the kind words that we receive back from our patients, and the gratitude that they show is probably the biggest motivation for us to keep going in spite of all adversities around us.
Definitely.
And I'll just give you a small example. I remember as a resident doctor, we had a very poor patient from village, and he didn't have enough money for treatment. Although in a government hospital, we presume that everything is free, but it's actually not free. They have to bring medicines, they have to bring certain other things for their treatment, the IV fluids, the injections and all those things, material for bandaging sometimes. So they were not even able to bring all those things. So we tried to arrange maximum possible things. And when he got his wife, an elderly gentleman, very old lady, she brought sweets for us, all of us. And she must have spent around 100 rupees on those sweets, which I'm talking of 1996, was a big sum for anybody. And for a person who is not even able to afford 500 rupees, 1000 rupees for the treatment, bringing
big deal for them.
rupees 100 worth of sweets and then coming and touching our feet.
Right.
And we were what? We were 23, 24 that time. Me and my seniors, my juniors. So that was a very touching moment.
Definitely.
Another instance, I remember I was walking in the corridor of the hospital and my parents were with me that time.
Okay.
They had come for some health related need, and I did my graduation and post-graduation from Varanasi, and I'm also a resident, born and brought up in Varanasi. So my parents were there, and while we were walking, suddenly a patient came and touched my feet.
Okay.
You know, the pride that parents have in seeing that, it was nothing big for me. In fact, I was a little embarrassed that this thing happened.
Yeah.
You know, your parents feel very proud about you that at a young age, you know, your son or your daughter is doing something good.
Even they feel that their son has done something huge that has been fruitful for someone else's life, that has saved someone else's life.
Yes. So there are umpteen such stories.
Right.
There are umpteen such stories, and I'm sure every doctor would have that, and that is probably what keeps us going, and also trying to inspire others,
right,
who want to do medicine.
Definitely so clearly, like as you talked about, that there are positives and again there are negatives of all these situations, but that's the story of each and every doctor, as you just mentioned. And we shouldn't lose hope, and we should work more and more towards inspiring more people to taking up this profession. Having said that, you also mentioned in the beginning that it is sort of difficult to manage your personal space and your professional space. So
absolutely.
How do you think how has your experience been of being able to manage your personal and professional life?
It has been a difficult journey, let me tell you.
Right.
I was fortunate, and I have been fortunate that at least my family understands. My parents understood, my siblings understood, and my spouse and children also understand.
Right.
But at the same time, you feel the pinch. You feel the pinch. And I'll just relate a very small story again here.
Right.
This is almost, I think, 12, 13 years ago, 14 years ago. My son was very small, 4 or 5 years old.
Okay.
And on a Sunday in the apartment where we live, he was roaming around on the ground floor outside in the common area.
Right.
And he met a gentleman who we know, stayed in the same building.
Okay.
And he said, "Uncle, kitna acha hota if you were a doctor and my father was going to office." We asked him why. He said, "At least he would have been home on Sunday." So that's how it is. We have, as a medical student in college, you know, when you are going from school to college, you think of all the masti and enjoyment that you will have in college,
right,
apart from the studies, which all of us had. Yes, I would not deny that. We also had our share of enjoyment in the college life. But a typical college would run from 9 to 2, maybe 9 to 4, and then you are free. You do some studies and you roam around. But as a medical student, right from second year, we have a college from 8 to 4 with a lunch break in between. And then we had evening clinics from 6 to 8, sometimes stretching up to 9 p.m. And that was our daily routine, 6 days a week.
Yeah.
Then continues the internship and the residency when the long hours are there. Very often, 24 hours duty used to be a norm. We were on 24 hours duty once a week, sometimes twice a week. But this used to stretch to 48 hours or even 72 hours at times.
Oh my God.
In a very difficult working conditions.
Right.
One has to go and see the condition of government hospitals in India to realize what those working conditions are.
Right.
No ACs in wards, no ACs in common areas, dirty, not very clean,
right,
and scant resources. You don't get everything that you actually need. Apart from that, sometimes you are exploited by your seniors,
right,
and even teachers.
Right.
You have to face very vindictive attitude sometimes. And this used to be there during our times. Things probably have changed, but that's how it is. It's the fun part of learning, the joy of learning, to some extent was curbed because of these things, because of these hardships. But nobody understands that. Definitely, least of all, I think the general public would understand that. Right. They have to spend few days in a hospital. And I can tell you again here, there have been many patients, once they have seen us taking care of, like family taking care of their patient and their family member, they realized and they came and told us, "Doctor, you people work very hard. We have seen how long hours you have spent, how you have been there for emergencies, how your team ran together. All of us were present." So once they see, they do realize. But unfortunately,
that was only after they got the first-hand experience of seeing you work.
Yes, and that too, not everybody. That's unfortunately a minority. Why it has happened? It is not an overnight development.
Right.
It is obviously the overall decay in society has come over the years, and obviously it is not mistake of only one side. It cannot happen. ताली दोनों हाथ से बजती है.
सही बात है, बिल्कुल.
So I'm sure there are shortcomings on our part as well. But having said that, I still feel large number of doctors and most of the doctors would not do anything wrong deliberately for their patients.
Right, definitely.
And I can very confidently say that this is still one of the noblest professions remaining.
It is absolutely no doubt in that, sir, because you are saving lives day in and day out. And what bigger a help to people can be than to save lives?
So I say we try to. Right. What I believe, and I truly believe that we do it and he or she delivers, whoever it is, the Almighty delivers.
Right.
That's my principle. But we have to understand we are human beings.
Exactly.
We are also bound to do mistakes. We are bound to get tired. In long working hours, it is bound. We are bound to do mistakes.
It's very exhausting. Exactly.
There are emergencies where we have to make split-second decisions. And those decisions may prove to be right, may prove to be wrong.
Right.
But we always try to take those decisions in the right spirit, in the best interest of the patient.
Exactly.
This is what I want people to understand. I'll just, as a comparison, if I tell you, there is a court case going on. And there also a person is punished.
Right.
Maybe punished wrongly. Maybe the lawyer did not work enough, did not do enough homework.
Right.
But nothing happens to the lawyer.
Yeah. But then again, in this situation,
on the basis of same evidences, there are two different judgments given in two different courts.
Exactly.
Right. Similarly, on the basis of same data, two different doctors may take different decisions to treat the patient.
Right.
And it may go differently. So we have to understand the intent behind it. We have to understand the sincerity behind it, rather than just start cursing them, hitting them. Violence, the extreme form of reaction that is shown these days very often.
Very often, exactly. And what we need to understand is the doctors are at least giving their best. They are doing their best in trying to save the patient, and it is their job, and they know how to do it. It's not necessarily their fault that whatever happens. It's not exactly how they planned. They never planned for it to happen.
Absolutely. So the medicine is a science, but medicine is more an art,
right,
rather than a science. So if you see 2 + 2 4 in mathematics, in medicine 2 + 2 is seldom going to be 4.
Right.
It's going to be 4.1 or 3.9 or even way beyond that.
Yeah.
So you can't just say, "Doctor, you said this will happen and this should have happened."
Right.
The body doesn't work that way.
That way. Exactly.
Biology and physics are two different things.
Very true. And so, as you said, and you mentioned that these days violence against doctors, the incidences of violence against doctors is increasing. So how do you react to such news? Because it must be very disheartening to see such things happen. So what kind of a reaction do you have towards such things?
Extremely frustrating.
Right.
And fearful. Every doctor has that fear in mind. And ultimately, I can tell you the society is going to be the loser. Yeah. It is already a loser, because there are times when the setup is small. It's a small place, it's a small city, and you do not exactly have the facility to treat that particular ailment.
Right.
But you do not even have that much of time to refer the patient to somewhere else.
Right, exactly.
In that case, most of the doctors what they would start doing, or they have already started doing at many times, many places, they would say, we cannot treat this patient, we do not have facilities, and they will simply refer the patient to a higher center.
Right.
When, if they would have tried, probably out of 10 times, they would have saved 6 or 7 patients at least.
Right.
In the process of referring them to a higher center, only 2 would get saved.
Right.
Because they would not be able to reach that place on time.
So the fear of such a reaction being inflicted upon them, they fear it, and that is why they say that it's better if they are treated at a bigger center.
Absolutely, everybody is worried about their property, their life, and their family's life. So a very recent case happened in Rajasthan, a young gynecologist, and whatever I read on the media, whatever I came to know from media, was she was a very bright student. She had excelled in academics and had a good practice in a small town where she was trying to deliver whatever was possible.
Right.
I'm sure you must have heard about her. And a lady died after delivery or during delivery or cesarean, probably after cesarean section. The family actually went in gratitude. They said, you tried your best, and they went away. But they were instigated by few people.
Right.
Yeah. That we will extract money out of doctors. So there is another notion that doctors are looting money. Doctors have made a lot of money. But what they see is tip of the iceberg.
Right.
They are probably seeing those doctors who have done well in their practice. They are not seeing that for every one doctor who is doing very well in the practice, there are hundreds who are barely able to make their ends meet.
Exactly. Especially in a situation that the kind of example that you mentioned was a small town in Rajasthan. So you can't even expect that the poor gynecologist, was she earning a lot or not? The point was that she was just trying her level best to save the patient.
No, she may be earning, but there's nothing wrong in earning it the right way.
Yeah, if she's working for it, then that is how it should be.
That's what. So yes, you have to be judicious. If there is a poor patient, you can do some concession.
Right.
Some discount, whichever is possible, because you can't be paying from your own pocket every time.
Exactly.
You can't do that, and we all do something which we can in our own capacity, in our own way, whichever way we are able to.
Right.
But then there are certain constraints. It's ultimately now into within the consumer forum. So it is considered a business, right? You have made a place, and you have to earn out of it.
Right.
The same is happening with the corporatization of healthcare.
Exactly.
Again, we have to understand a doctor working in a corporate hospital is not controlling everything.
Right.
And you cannot expect doctor to get you huge discounts there, because there are constraints that doctor has. There are constraints that healthcare facility has. They have also probably invested a lot into that facility.
There are certain policies in place. There are certain systems that you need to keep in mind before doing such things.
Exactly. So there has to be a balance somewhere. And this poor lady ultimately committed a suicide.
Right.
Because wrongly, it is illegal. She was charged with 302, which is homicide.
Wow.
Which cannot be done.
So bad. And so unfair.
Unfair. You cannot go and arrest a doctor unless you really find some crime committed there.
Right.
A patient dying because of some complication is not a crime. Leave alone negligence. It is not even negligence always. Very few percentages, it may be a negligence.
Right.
It is definitely not a crime.
Exactly.
So we have to differentiate between complication and negligence.
Exactly.
And negligence and crime.
But that line sort of blurs out in a lot of cases.
The emotions are running high.
Exactly.
In today's time, people do not have patience. When I came to Delhi NCR in 2006 and I read a story in newspaper that there was a road rage.
Okay.
Somebody was passing by very fast, and there was another gentleman who abused that person in the car. That person heard it, packed the car and ran it over the man. That man died. So it's probably the degradation of the society which is showing in every sphere.
Right.
And that anger comes out because they have either lost a near and dear one or they've had a complication.
There are frustrations that
coming out in the wrong way. Exactly. Because doctors are soft targets.
Right.
Somebody is driving, goes through a pothole, gets injured, comes to hospital, is probably not getting better, has a complication, dies. Will find the doctor as the scapegoat, but will not do anything to write to their corporator that this road should not have been like this.
Exactly. Very rightly said. These are the kind of things that people don't really realize, that it was not the doctor's fault, but probably an issue with the kind of situation that person was in.
Yes. There are children dying of diarrheal diseases, infectious diseases because of poor water supply, poor sanitation.
Right.
Who is responsible?
The doctors are considered responsible, even though sanitation is an issue that needs to be taken care of at the very basic level.
It's rainy season, and you know how Delhi, Gurugram, everywhere is flooded.
Yeah.
And every year after year, and that's the story of every city of the country.
Exactly.
So I don't say negligence doesn't happen. It does. At times it does. But that's a very small part.
Right.
The mistrust that has developed has to be bridged somewhere. And I think that has to be initiated from our side.
Definitely. There have to be conversations where people actually talk about these issues at a larger level than assume that whatever happened was probably the doctor's fault.
And I feel communication is the key.
It is.
If we tell our patients, and most of the times we have time to tell them, except emergencies when we can't explain everything. But if we tell our patients that this is your condition, this is what I plan to do, and this is why I plan to do, and these are the possible outcomes, including the adverse outcomes, the complication.
Right.
Even then, if there is a complication, it is very hard for them to accept.
Definitely.
But at least you started that communication. You have informed them. So it is easier for you to then explain later on.
Right.
That this is how and this is why it has happened, and we are trying to manage it. We have diagnosed the problem and we are trying to manage it.
Being honest in such situations is very important.
I think that will take away most of the problems and a good amount of mistrust.
Definitely. Sir, in the previous question, you talked about your college days and the kind of experiences that you had there. So, taking the conversation on a rather lighter note, during school or during college, when you started studying medicine, how was the experience of probably your first animal dissection or something of that sort that you'd like to share?
Yeah. So when you go to the dissection hall, the bodies were kept in formalin, and formalin has a very strong, not only smell, but it is irritant to your eyes also.
Okay.
Although they wash the bodies before they bring it to the table, but still there are fumes and it's not easy on your eyes.
Right.
Nowadays things have changed and the chemicals are better. But the first sight was very, very aversive. You know, you were taken aback. First time you are seeing a decayed kind of, not decayed, but it's an embalmed body. So it's quite preserved that way, but very shriveled kind of body. So that is the initial reaction, but then you very soon get used to it and you get on to it.
Right.
And in fact, dissection hall used to be a fun place for us also. We all would sit around, So we were a batch of 60 people, and there were 10 bodies which were given to us. So 6 students on every body.
Okay.
And like anywhere else, not everybody is interested in doing dissection. So every batch of 6, there are going to be 2 who are very gung-ho about it, or they want to do it. Couple of them who would maybe I will do it, and couple of them who are happy not doing it.
Exactly.
So you have lighter moments also, but then anatomy was the place which was probably the most strict department in our first year.
Okay.
So it wasn't easy, but yes, you could still do it.
Right.
So yes, I was one of those who was interested in doing it. and And out of, at least on our table, most of us were. So that's our initial impression. And then dissection hall becomes your second home kind of thing, because you spend a lot of time. Every day we used to spend almost 3-4 hours in the Department of Anatomy with lectures or with the body.
Right.
So, that's how it was. And anatomy was probably the most studied subject in the first year. Or we have 3 professionals, first professional, second and third. In the first professional, anatomy probably was the most studied subject, just for the reason because we had test every week.
Right.
A small test every week, a bigger test every month, and an even bigger test every term, and of course the final. So that's how it was. But it was fun.
Okay, that's great. So somehow a way to sort of lighten up the things that once you're interested into it, obviously in the beginning it's tough, but then again you sort of get used to it and start getting interest.
Yes. And we were taught in the beginning to respect those bodies. Right. There were people who have actually donated their bodies.
Right.
Most of them would be
for this purpose.
Yes, most of them would be unclaimed bodies. But I know of a friend, very close friend's father, who donated his body to Delhi College.
Okay. So, that's such a noble thing to do.
Yes.
So talking about this whole situation and the kind of last 2 years that the entire world has faced with COVID-19, how was your experience and the kind of mental health that you faced during this entire period of Corona?
So to be honest, when it began, there was a fear in our minds, everybody's minds.
Right.
And there was a fear in our mind because it was unknown to us.
Right.
We didn't know how it will turn, how it is caused. We were wary of touching anything.
Right.
Later on, it was proved that touch is okay because it will spread mainly by airborne spread is there.
Right.
We didn't know how to treat, and we didn't know how to treat ourselves and how to prevent largely. So there was an element of fear. But at least in my mind, there was never a doubt about continuing the work.
Right.
We have to take precautions and we have to continue our work.
Definitely.
I remember there was a meeting of management with senior doctors and especially surgeons, and we were all asked, would you like to continue to operate or not? We said, of course. And being in cancer surgeon, it is not that we can postpone surgeries for very long. So I said, of course, I would like to continue, but I also want proper safety precautions provided by the hospital.
Exactly.
If those are there, I will operate on patients. And we continued to cater for our patients. We continued to operate on our patients.
Right.
There were few who could wait for a month or so, and then we suggested that you wait for your safety. Also, because if you get COVID after surgery, COVID is going to be more complicated.
Right.
And those were very initial days when we were thinking that 21-day lockdown is all that we need.
It's just going to be it.
Yeah, but then it prolonged, and finally we operated those patients also after a couple of months because we realized, and the patients also realized,
but there's
that
no option. You have to go ahead with it.
So I was fortunate that I would not say I faced any mental health issues out of it, but yes, there were doctors, there were families of doctors who did face that.
Right.
They coped up, they continued their work, and hats off to all those people.
Definitely.
It was
heroes for the last 2 years for each one of us.
I would not like this word to be used because those heroes are made zeros in no time.
Right.
There were clappings and there were many things which were done, but very honestly, if you ask a doctor, what we need is a fair understanding of our jobs. That's it. And of course, everybody wants respect for the job that they are doing, and be it a doctor or a lawyer or whoever it is,
right.
A cleaning worker, cleaner, whoever, they want some dignity, some understanding, and some respect. And very honestly, at the core, every doctor would just want to have that.
Yeah. Very rightly said. And having said that, since you just mentioned it, I would like to ask you that on National Doctors Day, what is your message to your fellow Indians?
I would just like to say that we are also human beings. We also have ups and downs in our lives, personal lives as well as professional lives. we intentionally try to do the best for our patients.
Right.
Most of us, most of the times. Please try to understand us. Please ask your doctor about the disease,
right,
about the outcomes. Be prepared, be informed before you get into the treatment.
Right, being informed. That's the most important thing.
If you find a doctor who is not answering your questions, and fair amount of questions, you can't be asking the same questions again and again.
Right.
Then please find another doctor. Not a problem. Even if you have found a good doctor, you want to take an opinion, please go ahead and take that opinion. There is no harm in taking second opinion, but please don't make it fourth, fifth, sixth and endless opinions.
Right, because that
trust somebody.
Exactly. You're not trusting anyone in that sense.
Yes, you have to trust somebody.
Right.
And once you have trusted, please continue. Things may go wrong and things may go right. Your opinion should not change according to what is happening to the patient.
Exactly.
Your opinion can only change when you feel that this doctor has not done it, not thought of properly and not acted properly. Even after doing our best, we end up with problems, we end up with complications, and we end up losing our patient. I think that is the most important thing that people need to understand.
Very rightly said. Because after all, the most of what everyone can do is give their best. And if the doctor is giving their best, and if you trust them, if the entire process has been very smooth with that doctor, then you need to understand it's not their fault for whatever the result is. Yes, and
sometimes there are shortcomings, and doctor is not the only one taking care of the patient. There is a huge team which is involved, and not everything is under control, right? There are nurses, there are ward boys,
right.
There are admission staff, there are discharge staff. There are many people
involved in the whole process.
Yes, and yes, there is, I would say, a lack of required sensitivity. They are sensitive, but probably they need to up the ante.
Right.
Be a little more sensitive towards the need. And at the same time, patients and their family members also need to be a little more patient, a little more understanding, a little more tolerant. It's very easy to expect that doctor should be available all the time.
Right. But then
are you available to your clients? Yeah. Are you available to your clients or whoever you are serving all the time?
No.
Right. We have had patients coming to us and asking, doctor, in US this is what happens.
Right.
But what they forget is it is not possible to contact their doctor on a mobile phone there. It is not possible to get appointments on the next day or within a few days.
Right.
And of course it comes at a 10 times cost.
Definitely.
If you compare with a big private hospital. So let us be more practical, let us be more understanding of the situation on ground, and things will definitely move smoothly and happily.
For sure. And thank you so much for joining me today, Dr. Vedant, because these are the kind of insights that we don't understand as the masses. Because for us, it is that doctor ke paas jayenge and doctor theek kar dega, and agar nahi kiya, then there are consequences, the kind that our doctors do not deserve, which is wrong.
Yes, and also understand when you go for second opinion, the second doctor has slight advantage because that person has more number of investigations already available to him or her, right? The first one has already ordered something. The second one obviously has a certain advantage.
Definitely.
So you can't say the first one did not diagnose, did not do it properly.
They were working from the ground level, and while the second doctor sort of has some amount of insights coming from the first doctor.
Yes. So I'm not saying that every time the first one would be right, maybe wrong.
Right.
But we have to be a bit rational in deciding about it.
Very rightly said. Thank you so much, doctor, for joining me today. Wishing you a very happy Doctor's Day, and really hoping that things forward from here start improving as far as our relationship with our doctors are concerned.
Thank you, Niharika, and thank you for giving me this opportunity to voice my views, in also telling my brethren to be a little more sensitive,
right,
and also appealing to the masses to understand us better. Thank you very much, and I wish a very happy Doctor's Day to all my friends and colleagues and seniors. Thank you.
Thank you so much, doctor. So guys, you just heard Dr. Kabra talk about his work, talk about his experience as a doctor, and everything, positive and negative, that he went through during his entire career. This is not the story of one doctor. This is the story of all of our doctors. The kind of hard work that they do every single day, saving lives right, left, and center, helping out people who come to them, and giving their best to each and every one of their patients. We need to salute these heroes and be thankful for their presence in our lives, because the kind of work that they do cannot be done by anyone else. May the doctors of our country and our world live as long as possible. And this is from ABP Live Podcasts, a way to say a huge thank you to each and every doctor out there. For more such meaningful conversations, tune into Cracking Conversations only on ABP Live Podcasts. A very happy Doctor's Day to each one of you out there.
This is an ABP Live Podcast.